I'm Hanna Jones. I'm a PA here at Ada West Dermatology. I went to PA school at Idaho State University. I grew up in Oregon, on the western side of Oregon, but have gone back and forth between Oregon and Idaho over the last over a decade. We moved back to Idaho a couple years ago with my husband and 2 kids, and are so happy to be back. So I actually came through Ada West as a student on a 6-week clinical rotation through PA school years ago, and I remember having such a positive experience and realizing that Ada West really cared about patient care and was a very collaborative team environment for providers, patients, the whole staff. And that made a really positive impact on me even as a student years ago. And so when we decided to move back to Idaho, I immediately reached out and knew I wanted to join the team. Before joining Ada West Dermatology, I worked as a family medicine physician assistant for about 7 years, treating the general population for general medicine. One thing I wish patients maybe knew more about the process with dermatology specifically is that we may not have a definitive diagnosis the first time we meet, right? There may be a list of possibilities that we're looking at, what we call a differential diagnosis, and we may not have a definitive answer until we've seen the rash multiple times or the spot, or we've done further testing. And so I think coming in with that mindset, knowing that we may not leave with a definitive diagnosis on day one, but we're gonna work to get to that, I think is a great approach. I like to stay up to date on the most recent treatment options and procedures offered in dermatology by reading articles and attending CME conferences or continuing medical education conferences. So advice I would give a teenager specific to dermatology or otherwise would be, don't use an indoor tanning bed. Un hecho sorprendente sobre mí es que hablo español. A surprising fact about me is that I speak Spanish. I learned through school, through middle school, high school, and college, took courses, actually have a third bachelor's degree in Spanish, and I worked in a lab in Spain. So I've done multiple trips abroad and worked abroad.
Describe yourself in 3 words.
In 3 words, I'd say organized, organized, outgoing, and optimistic. Something I'd want to relive would be a vacation I took with my husband and 2 children a couple summers ago where we spent a lot of quality time together and got to see some really beautiful places, and I would do it all over again. If I was going to give advice to someone interested in going to PA school, I would say to gain your medical experience or clinical experience hours in a variety of settings and medical settings. I think PAs have such a large scope now and can be utilized in so many pockets of medicine that seeing the possibilities before you start is a really great idea. One thing I could not resist is anything with cream cheese frosting on it. 2 products I most commonly recommend are CeraVe's Moisturizing Cream. It's a really nice thick moisturizer we can use for lots of skin issues. And the other would be a sunscreen recommendation from La Roche-Posay. It's a nice tinted mineral sunscreen that's really liquidy, so it goes on really thin, which is nice. I recommend a gentle cleanser, either Vanicream or CeraVe or Cetaphil make the nicest. My favorite sunless tanner is from Tan Luxe. I recommend 2 formulations. One is called the Water. It's a spray-on formulation that's really nice and doesn't typically transfer to clothes. And another is, I think it's called the Face, and it's an oil dropper that you can add to your moisturizer.